Wikidonist.com. Truth about tooth.
We all love our steak. I love it. Sometimes most of the people who are elderly, they are like, they love the steak, or they love some of the fibrous food. Sometimes even vegetarians, they have all this fibrous food, and then most of the people are very scared about eating them because they have space between the teeth. They have all the teeth, but they have space between the teeth, so the food gets in between, and then they have to use a toothpick, or sometimes a pin, or sometimes a thread, or something like that. So otherwise it's just too much of pain and things like that. So today's video is about food getting in between teeth, and the problems associated, and how to avoid the teeth getting in between teeth, and how we can treat it. So now what are the reasons for it? One is basic reason for it is sometimes it is caries, or the biggest disease of all time is actually dental caries. If there is caries between two teeth, definitely there is a space between the two teeth, and there will be food getting in between the teeth. First of all, caries itself would have started because there was food getting in between the teeth. So now, if there is a space between the teeth, go to the dentist, check it up, because it may be a caries. If it is a caries, it's very simple. Do a filling. You can do a class 2 filling. Hardly, if it is in India, it's like 1,000 rupees to 2,000 rupees, so it hardly cost you anything. We can just finish it off like that. But if there is a tooth which is lost, actually if you have lost one tooth because of some reason, or somebody have removed one tooth, then what happens is the tooth adjacent will move to that space. So that means that there will be space between around the tooth. So there will be food getting in between the smaller spaces, and then it will be difficult for you to eat meat without getting in between the teeth, especially meat or even fibrous food. So now then you will stop eating, or we will avoid all those things, but still there will be food getting in between, but since it is not very thick, you will not know about it. If it is staying there, then what happens is there will be caries forming, because the food was there and you didn't clean it, and then you didn't see it, you didn't clean it, and then it becomes a caries, or sometimes it becomes a gum issue. So if there is a caries or a gum issue which is not sorted out, you might lose the teeth. So now what has to be done? So we have to actually correct it with replacing that tooth. Now replacing the tooth can be done in different ways. One is actually to do a implant, or to go for a bridge. In these cases, the simplest way is to do a to do a bridge rather than an implant. Why? Because implant is actually directly screwed to the bone, so you are not dealing with the space between the adjacent teeth. So if you are going for an implant, actually we should actually if you look into the international literature, they say to do an orthodontics with aligners or with braces, and then move the teeth which is actually moved into that space, and move the teeth away, and actually close the space between with orthodontics, and then do the implant. The simplest way is to do a bridge, wherein you connect all these teeth which is nearby, and close the spaces and do the bridge. That is the easiest way. Now if you have not lost the teeth, still you have spaces, that is also possible, because the last teeth can actually drift backwards, or if I have a little bit of periodontal problem, or if there is a plunger cusp, there is a cusp which is actually overhanging into that space, then it can be actually pushed like like pushing something in between, using a sharp thing. You can actually push something in between two teeth. So like that, maybe your upper teeth is actually having a plunger cusp and it is actually pushing. You can just round it off. Sometimes that goes off like that itself. If it has been there for quite some time, then the tooth would have moved and there is a space proper. So now in that cases, what has to be done? In that cases also we can correct it using a joint crown. We can actually place two crowns together, and then we can close the space. Whatever come and done, if there is a space between the teeth, please don't use a toothpick, rather use a floss. You can actually use a floss, but if there is a lot of food, every time you go you cannot use a floss. If there is a lot of material there, and if there is a lot of material, then it can go to caries and periodontal issues. Please make sure that you join the crowns together so that food doesn't get in between, because especially if you have diabetic and things like that, or osteoporosis, you can lose the teeth due to periodontal issues if you have food getting in between the teeth. So if you have food getting in between teeth and if you are worried about eating, please make sure that you actually do either of these treatments. Now, if you are seeing somebody with a toothpick and doing all the time taking out large pieces of food between the teeth, please make sure that you send this video to them so that they will be also benefited. Now, if you are having that problem, please don't use a metal object to remove the food. If you are still using a toothpick, make sure that it is coming from a quality. And second thing is, the toothpick itself can actually embed fibers of wood fibers into your gums and cause trouble. So all these things I will tell you, don't use a toothpick. If you have food getting in between, the simplest way is to use a floss. Use a floss, take the food out. If there is a lot of food, please watch the video and get the treatments done. I am Dr. Thomas Nechupadam. If you are seeing my video for the first time, please make sure that you subscribe, and if you are watching it on Facebook or Instagram, please follow and like and share, and make sure that you send it to all your older friends, because they may be worried about having food getting between the teeth, and this is an ideal way to get them into good treatments and get them started with having good food, which what they enjoy, what they used to cherish, and they'll be happy to get this video for themselves. I am Dr. Thomas Nechupadam from Nechupadam Dental. Have a great day. Have a great smile.
Wikidonist.com. Truth about tooth.